and welcome everyone to today's webinar. Good afternoon or good morning, depending on where you're joining us from. My name is Sakirtha Thermalingam, Senior Manager of Evaluation here at Canada Health Infoway. And thank you to all of you for joining today's webinar. We're very excited about today's agenda. Waldo, if you advance the next slide. So I'm going to do a quick welcome and introduction, and we're going to jump right into results from our Canadian Digital Health Survey. This is an annual survey that Infoway conducts where we get a sense of Canadians' perceptions and attitudes around their digital health expectations, experiences, and interactions with the healthcare system. And we've grown this survey over the years, and very pleased with the rich and robust data source this has become for not only informing our business needs, but also our collaborators and many of you on the line that hopefully will benefit from the findings that we will be sharing with you today. And following that, we'll open it up to a Q&A, and I do want to remind you that you can submit your questions as they arise throughout the webinar, but I'll moderate them when we've gone through the whole presentation. But you can feel free to submit them throughout the webinar. So if you go to the next slide. If those of you that are new to today's webinar, a big welcome. Thank you for joining us. The Infoways V Collaboration Network together, we've been hosting these webinars for a number of years now, where we bring folks that are interested in digital health evaluation, where we share learnings from our evaluations. We offer a platform for others to also share insights on digital health evaluation that they're embarking on. And we are open to anyone interested in this space to join us. The contact information is there for you to send an email to, and you can get on our distribution list. And there's the link there where you can go to find the slides from today's webinar, as well as any other updates regarding our network. And those of you that have joined today, we will be following up with you through email with a copy of this presentation once it becomes available, and the related report. If you go to the next slide. I'm very excited to be presenting to my colleague here, Waldo. Waldo is a senior analyst with the performance analytics team here at Canada Health Infoway. He has extensive experience in applied social research and quantitative research methods for over 10 years, and has a master's degree in applied economics. He has led, and he's been a guest here on a number of occasions, and some of you have met him before. He's led a number of important evaluations here at Infoway, led important quantitative surveys, and he's led this piece of work that he's going to be walking us through. So over to you, Waldo.
Okay, thank you. Thank you, Sakirtha. Hi, everyone. Thanks for joining this this webinar today, and thanks Sakirtha for this wonderful introduction. So I just want to add that I've led both clinicians and citizen surveys at Infoway. I'm a senior analyst. I've worked on a variety of topics that include digital health equity, environmental and financial benefits of digital health or virtual care, the uptake of virtual care during the pandemic of COVID-19, and I'm currently working on a piece of analysis with CIHI, and it's on appropriate use of virtual care. I have sat on different national committees or working groups, the unintended consequences of COVID-19 working group, the equity working group led by Health Canada, just to name a few. Now, I want to take some time to give you a little bit of background about the Canadian Digital Health Survey. First of all, it is a cross-sectional survey that we conduct on an annual basis. So we design and develop the survey questionnaire. We hire a market research firm to implement the survey. We'll get into the methodology in the next slide. But the main purpose of this survey is to produce data on access and utilization of digital health services by Canadians, and their perceptions about the services. And more specifically, the Canadian Digital Health Survey enables us to picture the digital health landscape in Canada in terms of access and use from the patient's perspective. So we collect a variety of digital health services that include PHI, virtual care services, and e-mental health services, etc. We also looked into connected health and coordination of care with the attempt to analyze interoperability through patient's lens. And the data we collected from this section of the survey, and by the way, it was a new section that we added last year. So with this section, we should be able, and we were able to complement the insights generated from the interoperability study we carried out in the summer of, it was last year, 2022, last summer. And it was a survey about clinicians. So this piece, this survey about Canadians, this section, to be more specific, will allow us to complement the data we generated from the interoperability study. And the last piece about the Canadian Digital Health Survey is the digital health literacy, an important driver of digital health use. And you'll see that throughout the presentation. Now, as I said earlier, a market research firm, and this time it was Leger, was hired to implement the survey. So the way they do it, they own an online panel of 400,000 representative panelists from all regions in Canada. And from this panel, we were able to achieve a sample size of 12,445 Canadians across provinces and territories in 2022. So the table you have on the right-hand side yields the regional breakdown of the total sample. So as you can see in here, we have the bulk coming from Ontario and Quebec. Now, in terms of the implementation of the survey, or in terms of data collection methods, we rely on a web survey, and data collection took place in November 2022. Now, finally, we applied weights generated from the 2021 Canadian population census just to make the population, to try to make the sample representative of the Canadian population. And for more information about the methodology, the full report will be posted on Infoway's corporate website. Now, what is unique about this survey? Number one, it's a pan-Canadian survey. And in that sense, it allows us to learn from each other. I mean, from a jurisdictional perspective. So we know the lessons learned, we can share the lessons learned. So that's the first thing about this survey. The second thing, it contributes to some of the priority indicators monitored by Health Canada. As you shall see throughout the presentation, we generate information, or we generate data on access to personal health information. And it's one of Health Canada's priority KPIs. And I think most of the metrics that we generate from this survey, they tend to be patient-reported measures. So this puts the patient at the center of the insights generation process. So we don't only see the patient as a unit of observation, but we put them in the center, so they provide the information. And lastly, I think the indicators that we collect are easy to use and easy to digest. And for that, our team has built an interactive web-based data and analytics hub that anyone can use to slice and dice some of the results that we generate from the survey. We'll share the link to this website. This is, as I mentioned, is a web-based analytics hub that you can use on your own. Now, before we get into the results of the survey, I have two polling questions for you. The first polling question, I'm going to read it out for you. Are you interested in any of the following digital health services? So it's a select all that apply, except for the last category. This one is mutually exclusive. So if you select E, please don't select other letters. So I'll give you some time so you can answer the question. I think that's it. Can we see the results? Wow, interesting. We have some interesting results. 96% of people are interested in accessing their personal health information, which I think is fascinating. You'll see the results from the survey, from the actual survey. We have e-mental health services with 56%, 83% for having a virtual video, and then 92% for online booking. Wow, this is fascinating. And the second polling question, which is going to be the last one, is this one was about interest. Let's see if you've accessed any of these services. Have you ever accessed any of the following digital health services in the past? Any time in the past? Select all that apply. So I'll give you a couple of, I'll give you a minute just to complete. Okay, I think we can see the results now. For the results, let's see. We've seen a high interest in online booking, but in terms of access, 69%, the highest percentage in terms of access goes to access to own personal health information, PHI. We have ties for video conference and online booking, 36%. And then e-mental health services, 20%. That is fantastic. Now, the polling questions. So we have two polling questions. Number one, it was about the interest in a list of digital health services. The second polling question was about access. This is exactly what we are going to talk about today. We'll take a look at the demand for some digital health services, and then we will move to the interest. So the way we have this presentation organized, so the first two slides will be about demand for and use of digital health services. And then by comparing the two, we'll take a look at the gaps or the unmet demand for digital health services. Next, we'll make a deeper dive into 3 digital health services, personal health information. And I've seen that we had a high interest for this service from the polling, e-mental health services and virtual care services. So for these 3 services, we will look into Canadians' perceptions of the services, their demand for them, and then access. And the last section is about digital health literacy. Now, for the 2022 Canadian Digital Health Survey, we have collected a list of, well, let's say, a dozen digital health services, and this is what we have in here. So this slide presents the demand for and use of these services. So the brighter blue corresponds to the interest or the demand for digital health services, and the lighter blue is the access. And for the access, we asked the question, have you ever used any time in the past? Now, overall, 94% of Canadians are interested in at least one of the digital health services that we have in here. Now, when comparing bright blue with light blue, we can see that high interest does not necessarily equate high usage. And to give you an example, send a request electronically for a prescription renewal, we have 76% for interest, but only 20% access. And again, for view an electronic version of my referral to a specialist sent by my regular doctor to a specialist, we have 70% in terms of demand, but only 12% for access. Now you can see there is a gap. We do have some gaps for some of the services. And when we taking the arithmetic difference between the interest and access, we get the gaps or unmet demand for digital health services. So what we have in here, we have, first of all, we've sorted the list from the largest gap to the lowest gap. And we've broken this down into 3 categories. The first category, they have a gap of 50% and plus. And for example, we have online booking, where we have a big gap, 52%. The second category, where we have gaps lying between 40% and 49%. In this category, we can find access to PHI, personal health information. And the last category, where they have less than 40% gap, in this category, we can find phone consults and then have a prescription sent directly to the pharmacist by the prescriber. Now, moving to the services, as I mentioned earlier, you've seen the demand on one side, the access, and then by combining or by taking the difference, we get the gaps. Now, for 3 of the digital services that we presented, we are going to dive a little deeper. We'll take a look at the demand. In some instances, we'll take a look at regional breakdowns, and then the perceptions of Canadians' perceptions about some of the services, starting with access to personal health information. For access to personal health information, let's first take a look at regional breakdowns. As you can see here, the 36%, you've seen this in the previous slide. This is the national average. And above this average, we have BC with 48%, Alberta with 47%, Saskatchewan with 56%. And then below the national average, we have Manitoba, Ontario with 35%. We have Quebec with 33%, and the Atlantic with 13%. Now, in terms of breakdown by other demographics, starting with age, the first thing that we found was access to personal health information tends to increase with age. So as you can see in here, seniors, they were more likely with 44% to get access to their personal health information compared to the other age groups. Now, access to personal health information, as you can see in here, those with access to a family physician, they were more likely with 38% to have access to the personal health information compared to those with no access or with no family physician. And for the last geographic variable or health status, those with chronic condition versus those without a chronic condition, as you can see in here, those with a chronic condition, they were more likely with 41% to access their personal health information compared to those with no chronic condition with 30%. Now, when we ask respondents about access to personal health information, we were referring to access to lab results, access to immunization records, access to list of current medications or medication history. So this is what we meant by access to personal health information. And as you can see on the left-hand side, you have the percentage of Canadians accessing each of this piece of personal health information. For lab results, for instance, 82% of Canadians said they had access to the lab results, 55% with for immunization. And on the right-hand side, we also have the platforms or the most frequent platforms used to access personal health information. And we have 3 big buckets. We have the first one is the lab service providers with 33%, provincial portals with 31%, and we have healthcare providers with 21% of Canadians using this platform to access their personal health information. And we tried to get a sense of access to comprehensive personal health information, because as I mentioned earlier, the way we define personal health information, or what was included in personal health information when we collected the survey, was lab test, immunization, etc. But we tried to get a sense of access to comprehensive personal health information. And we found that we were at 14% of Canadians reporting that they can access, they have access to their comprehensive personal health information. Now, we've seen the platforms used to access the personal health information. We've seen the pieces of information Canadians have access to. Now, what about their perceptions? Their perceptions about these platforms. So this slide answered this question. So we have used a Likert scale and a list of statements to measure perceptions. Here we are reporting percentage of agree, because we had a Likert scale. So we had strongly agree, agree, moderately agree, disagree. So what we are reporting in here is the percentage agree. So as you can see in here, the first thing that I would like to draw your attention to is ease of use. So the online source where I can access my personal health information is easy to use. So we have 86% of Canadians reporting ease of use, and we know ease of use is important for inclusivity. Easy to use solutions, so more people will consume it, we'll see an uptake of it. The second one is about using personal health information to better manage health, because Canadians are not only accessing their personal health information for the sake of accessing it, they are accessing their personal health information because they want to be able to better manage their health. And lastly, 53% of Canadians reported that they were able to avoid an in-person visit with their family doctor or regular place of care, or to a walk-in clinic at least once, because they were able to access their personal health information electronically. Now, moving to access to e-mental health services, and starting with the demand and then the modalities. So on the left-hand side, we have the demand. Again, you've seen this number, the 57%. It was presented on the first slide when we presented demand and access. So we have 57% demand for e-mental health services. We have 13% utilization or access, and the 9% is a subset of the 13%. When we asked the question about access, we had two ways we collected the information. We asked Canadian, have you ever used it in the past, anytime in the past? And then we also asked them, have you used it in the past 12 months? And this is what we have. This is what the 9% refers to. Now, on the right-hand side, we have the modalities that were used to access e-mental health services. And as you can see in here, on the top of the list, we have phone. 42% of Canadians that are using or that access e-mental health services, they use phone to access the services. 32% website, 3% video service or video services. And you also have 15% using social media and 14% using patient portals. Now, in terms of perceptions about e-mental health services, platforms, and modalities used, again, similar to what we did for PHI, we use a Likert scale. We are reporting percentage of people who said they agree by combining strongly agree and agree. And starting with ease of use, the e-mental health service I used is easy to navigate. So we have 88% of Canadians who agree with that. And satisfaction. Satisfaction is really important when it comes to patients' experience. So overall, they said they were satisfied with the care they received virtually. And then the last one that I would like to point out is they were able to avoid at least one in-person visit to a doctor or an emergency room as a result of using e-mental health services. We have 78% of people reporting that. Now moving to the last digital health service, access to virtual care services. For access to the virtual care services, starting with demand and access. So for digital health services, we collected three modalities: phone consults, video conference, and then secure messaging. As you can see in here, in terms of demand, we have the highest goes to phone consults, which was the case when we started, when we collected information at the very beginning of the pandemic. And video conference, 59% in terms of interest and 59% for secure messaging. Now, in terms of access, also, we still have phone with 40%, the bulk of access to virtual care services, 18% for video conferencing, and 13% for secure messaging. And the set of bars that you have on the left, this is when we combine phone, video, and secure messaging. So this is just to talk about virtual care in general. And in general, 81% of Canadians, they are interested in at least one of the services. And in terms of access, we are at 52%. Now, the reasons for choosing virtual healthcare provider visit instead of in-person. Again, we are not trying to put in-person visits and virtual visits face-to-face. We are trying to understand the reasons for choosing virtual care services. And this probably will inform any analysis related to appropriate use of virtual care, for instance. And as you can see in here, the first thing that we should highlight in here is that Canadians continue to see values in virtual care use. For example, time savings. We have 41% of Canadians reporting that they were able to save time with virtual care use. Or financial savings, 19% of Canadians saying that virtual care saved me money. And even lowering geographic barriers, although it's 6%, but we still, some Canadians continue to see virtual care as a means to lower barrier, access barrier, and to be more specific, geographic barriers. Now, in terms of perceptions about virtual care, we collected only 3 indicators. The number one is about the sense of safety when using virtual care. And we have 92% of Canadians who reported I felt safe emotionally and physically during the virtual appointment that I had, 92% of Canadians. And the second one was about, so we had 89% of Canadians saying that the virtual visit they had, they were able to, their health concern was addressed during this visit. And lastly, 85% of Canadians who had a virtual visit were able to communicate their health issues as well as they would have in person. Now, in terms of the preferred modality for the visits under each circumstance, so as you can see in here, we have a list of circumstances: annual examinations, routine examination and screening, mental health, follow-up of health problem, minor problem. And as you can see, I've highlighted the last 3. So as you can see in here, we have high percentages for this 3 when it comes to using virtual modalities. For example, for follow-up of a health problem, 40% of Canadians report they would prefer to use phone call, or 12% would prefer video conference. And then for a minor health problem like coughs and colds, you have 44% of Canadians reporting that they would prefer to have a phone call for this problem, and 17% would prefer a video conference. And lastly, prescription renewal, 53% of Canadians said, I prefer to have my prescription renewal through phone calls. 5% would prefer to have it through video conference. Now, the last section is about digital health literacy. And to measure digital health literacy, we use the eHeals, which is a eight-item 5-point scale instrument that measures perceived skills at finding, evaluating, and applying electronic health information to health problems. So that's what the eHeals is about. Now, the first thing, so what we have in here is the list of the 8 items that we have on the eHeals. And when we combine the score, and just so you know, since it is an 8-item 5-point scale, the maximum score is 40. 5 times 8, it's 40. And for a national average, we are sitting at 27. So we have the scale ranging, the score ranges from you have a score from a 5-point or 8-point, 5-point to be more specific, to 40 points. Now we are at 27. So now you can see the difference, although we are above the midpoint, but we are not very close to the maximum. The closer we get to the maximum, so the better we have, the better the digital health literacy. Now, what is the key message in all of this? The first thing that we need to see in here, throughout the presentation, is that Canadians, they are enthusiastic about digital health services. So we do have some satisfactory access rates, but we still have some gaps that persist for several services. We've seen that when we compared demand with access. The second thing is Canadians are keen on getting access to their personal health information for better management of their health. And we know that patient experience is an important factor. We want to be able to improve Canadians' patient experience. So they are enthusiastic. Let's try to enhance their patient experience. So I will turn it over to Secretary for the questions. Thank you for your attention.
Thank you, Waldo. That was great. Thanks so much for that overview. I'll just remind everybody that you can submit your questions through the Q&A function, and I've already seen some coming in. So we'll start with those there, and feel free to submit any questions you have through the typing feature, the Q&A feature. We won't be taking any audio questions. So maybe I'll start with a question. Actually, Waldo, if you can go to the next slide. One of the questions we got from a few attendees was about if they're going to be able to, oh, no, to the next slide. Yeah, there. If they'll be able to see some of these results, if they'll get access to it. And the answer is yes. So some of this is already available on our website. We will be releasing the full report from the survey over the next couple of days. And all of you on the webinar today and those that registered will get a note when we posted the full report on our website. And I also want to draw your attention to Infoway Insights, where you can go look at this data interactively, and that'll also be available. And we'll make mention of that in our email to you when it's all available publicly. We'll get to some detailed questions. And one of the questions here, Waldo, is about a couple questions about the demographics. Do you have a sense of the age breakdown of the participants in the participants of the survey?
Yes, I can answer this.
Yeah.
Sorry.
Go ahead.
Yeah, in terms of age groups, first of all, for the population of reference for the survey, it was 16 years and plus. Now, in terms of breakdown, we have the bulk was coming from those with, I would say, 35 to 54 years. And then we have a pretty high percentage from the seniors, 65 to plus. So we have 23% of the sample was coming from this group. So again, to repeat, 31%. So the bulk was coming from the age group 35 to 54. And then for the seniors, we had 23%.
Great. Thank you, Waldo. And then we've got a question specific to slide 22. And the question is, so this was around the perceptions of the most recent virtual visit. And the question is around using our data, will we be able to understand those that had a negative experience, the demographics of the individuals that had a negative experience?
For negative experience, we didn't collect it, but what we can do, if we slice and dice and go deeper, because what we presented, the way the questionnaire is built, for those who have access to some of the digital health services, for example, personal health information, access to virtual care, access to e-mental health services, we ask them about their experience. Now, what we don't have those who didn't access these services, what are their demographics and why they couldn't access these services. We didn't collect this. So that's why it is a bit difficult to know whether they had a bad experience with the services.
Great, thank you. If you can go back to slide 14, there is another detailed, I think, question around access to PHI. The question is around defining the comprehensive PHI, and maybe I can elaborate on that one. So we provide an estimate here of 14% of Canadians having access to comprehensive personal health information. We draw this distinction by looking at jurisdictions where we know citizens have access to a patient portal, for example, Alberta, Quebec, Saskatchewan. And so the estimate is drawn from those, that population, because as you can see on the left there, most Canadians tend to have access to a specific component of their personal health information. I'll move on to another question. If you want to go back to the final slide there, so we've got our coordinates available for people wanting to follow up. Waldo, this question's for you. So you mentioned this is the, we do this survey annually, and there was actually a question about when this data was from, and this is 2022 data. And the question is, when you're looking at some of the demands for digital health services, how is this year's demand comparing to previous iteration of this survey in the previous year?
That's a very interesting question. So we didn't present the trend in here, but what I can tell you, for some of the services, we've seen an increase in the access. For example, access to PHI. For example, in 2016, we were at 18% access, and it has doubled in 2022 with 36%. Now, on one hand, you have the demand that is growing, and on the other hand, you have access that is growing at the same time. But with PHI, personal health information, access grew at a higher rate than the demand, and we've seen a decline in the unmet demand over time from 2019 to 2022. But it was the opposite for e-mental health services. We've seen an increase in the demand for e-mental health services, but a very slow progress when it comes to access. So we've seen for the unmet demand, it tended to grow compared to personal health information. And that was the case for virtual care services. We've seen an increase in interest, but let's say a slow increase in the access.
Great, thank you. I've got another question here around the methodology. The question is, this is a web survey. Did we use other methods to capture issues around digital health access and literacy for those without access to the web who weren't able to conduct the survey? and have their experiences been captured? So did we do a telephone survey or was there a telephone component to this? And I'll let you expand on the methodology.
Okay, for the methodology, as I mentioned earlier, it was a web survey, online survey, totally online. So I think for next iteration or iterations of the survey, we will try to get to be more inclusive when it comes to those who don't have access to internet and get their perspectives when it comes to use and access to digital health services. But for the Canadian Digital Health Survey, it's totally a web survey. But we do have a survey that we conducted before the pandemic and during the pandemic. It was the national consultation. And for this one, we conflated different data collection methods, phones, web, so we can get a sense of those who don't have access to the internet.
Great, thank you. There's a question here about, is there a breakdown for access to online appointment booking as presented for the PHI access?
It's not presented in here, but I think we can, when we present the report, you should be able to see access to PHI by modality. Was the question about the modality or?
Access, I think it may be, I think just some of the breakdowns, and you're right, Waldo, when we have the report, and insights would be the other place where you can see jurisdictional breakdown and other breakdowns. There's another question around, or a comment around, there's been a lot of misinformation around the use of services for digital authentication, authorization, and identity. Is there any data on the use and comfort of using these services in order to enable secure and privacy protected access to the various digital health services discussed?
Yeah, that's an interesting question. I think we have a survey for that, and the data, they were posted on our website. For those interested in this analysis, we have something on Insights, our website, data analytics website. We also have the report posted on our website, Infoway corporate website. It's about privacy. Yeah, it was about privacy.
Couple of more comments here about interest in this PowerPoint and reporting. So just wanted to reiterate that we will be sharing all of that following the webinar over the next couple of days when we've got the full report, as well as a link to the webinar as well. I think that's all the questions that we've had come in. Wait, I'm kind of doing this live, and I think there are more questions coming in. And this is another great question. And I think all of these questions are really sparking an interest, I think, in this data set, and which is great because there is a wealth of information that you can access once we've made this more publicly available. But the question, Waldo, is, have you looked at the results for rural versus urban respondents, if possible? There's this person is interested in if there's any trends or differences between the rural versus urban groups, as we often think of online services as helping to bridge the service access to gaps for rural populations. And what does the data tell us?
For the current, for the 2020, the freshly collected data that we have in here, the 2022, we are working on digital health equity analysis, which is going to be the third iteration of this type of analysis. In the past, we looked at the differences between urban Canadians and rural Canadians. And from the 2021 Canadian Digital Health Survey, we've seen a higher uptake in the urban areas compared to rural. So stay tuned. We are working on an analysis for that. We'll be doing, we will slice and dice, trying to understand access and looking at some equity stratifiers or indicators to get a better sense of access and use of digital health services.
Thank you, Waldo. And I think that's all the time we have, or that's all the questions that I've gotten. So we're going to be happy to give you back some time, and really thank you so much to all of the attendees. Thank you for your interest in this work, and really glad to see the number of questions that have come in, the level of detail you're interested in getting from this data set. And we're very pleased that it sounds like there will be a lot of use from this data, and we encourage you to check out the full data set when it is made publicly available. And we hope to continue to stay in touch with you on future webinars of other evaluation activities that we're engaged in. Thank you, everyone.
Thank you. Take care.